what about stress in our lives? Because stress
So
tells our
correct.
brain a lot of things
Absolutely.
that suddenly come out of nowhere. How do we deal with that? And then how does that affect this whole issue?
So one of the other things that was on that graphic was sleep, right? So sleep can actually affect how much of these hormones are secreted and made. It's also very important that we understand that during sleep, and particularly during what's called non-REM sleep, that time in your brain that it's at its core basic functions, it really helps balance out these hormones.
But how do you control it? I mean, is it one of those things that happens? We try to control stress every day, but is it simply something that comes out of the brain that activates, that is part of the whole hunger issue itself that we can't control no matter what we do?
The brain receives the signal from the hormones that are created outside of the brain. The brain balances out, and that's the idea. So that's why sleep is important, because if you're sleeping efficiently, then the brain is appropriately receiving these signals. One of the core pillars of obesity medicine treatment is evaluating you for something called obstructive sleep apnea. If there is an interrupted sleep architecture, and I'll try to explain quickly what that means, then your brain is not receiving those signals during the most important time, which is during healthy sleep. So getting healthy exercise, as we've often hear, is just as important as getting healthy sleep. And part of the reason why that is, we know now, is because during non-REM sleep, you need to be able to interpret those hormonal influences normally. And if you're having difficulties breathing and you're struggling and gasping for air, then the brain really isn't doing that very efficiently. And that may lead to more obesity.